26 years, I struggled with addiction. I came from a good family. I was well educated. I was bright enough. I had every opportunity. And then began what seemed at the time to be an innocent foray with alcohol at the age of 17. My addiction soon evolved into a life and death struggle with prescription opiate painkillers. It was outside of my control. My habit grew over the years like an overfed beast, and I eventually found myself hopelessly bound with absolutely no way out. Like much else, prescription shopping is mostly about relationship. My guess is that doctors, specifically ER docs, feel overwhelmed and overworked, and therefore adhere to monitoring procedures as little as possible. Also, the attempt to compel them to bear the burden of the monitoring is probably something that they resent, as they already feel spread too thin. Because of this, human nature probably causes them to do as little as possible. Of course, this is conjecture on my part, but it is based on many exchanges with doctors in crisis environments. This brings me back to my position on relationships. It seems to me that doctors, as a rule, have defaulted to personal perception of the patient in the determination of whether to prescribe opiate painkillers. Let me explain what I mean. If a patient arrives at a care provider demonstrating peculiar affect, the doctor typically takes the hard line and immediately denies the prescription. I have seen this happen umpteen times in the case of others. However, because of this, I would always approach with a plan. Develop relationship, establish common interests, know my target and therefore use keywords that would indicate normalcy, speak well, downplay my need for medication, and feign unfamiliarity with the opiate medications. I would also advance with a stated allergy to the non-opiate medications that are often used as an alternative to the opiate medications, thus limiting the doctor's ability to explore options for pain relief. As a result of all these things, I was fairly successful. I am not the only one by any stretch that had marked success with these techniques, and I am certainly not the only one savvy to them. My belief was always that if I gave a doctor little reason to suspect my intentions, my ratio of success would greatly increase. The results would indicate that I was correct in this belief. If individual doctors were obligated to check the prescription drug monitoring program each time they prescribed, the autonomy would be removed. It is the individual autonomy that created my success. If I could develop relationship, I could basically leave with my prescription of choice. It would render the script shopper impotent in this process. In short order, the search would move to the street, near permanently. I don't know if this would be positive or negative. A better mind than mine would have to answer that question. I am not addicted any longer. For many years, I tried to find freedom from that which held me captive, and I could find no way out. However, recently, I met Jesus, and as a result of that meeting, I found the freedom that was always so elusive. All of the chains that once bound me fell away. Now, rather, I am a minister out on the streets, in direct contact with addicts and homeless folk that struggle in the same ways that I once struggled, and search for freedom in the same way that I once searched for freedom. Once I was a pariah, and now I am someone who is on the streets for the purpose of helping those that struggle with what I once struggled with. And I hear a lot of the same things from them, that they also utilize prescription shopping as a means to feed their addiction. The prescription drug monitoring program will be a great component to helping keep people that are bound safe from themselves before they can find freedom from their addiction. But I know there is freedom to be found.